And I am really excited to welcome Alban Manio. I always botch his last name, and Angie Hunt to the stage. They are going to help us learn about Memory Lane TV today, which is really an innovative platform that I was not aware of until just recently. And so we're all going to learn about this together today. Um, and forgive me, or Angie. Why am I calling you Debbie? Angie has her name tag as Alban too. We couldn't change that. It's my fault. Everything's my fault. Anyways, really excited to dive into Memory Lane TV today. But before we do that, let's meet the two of you. Alban, tell us a little bit about your background and what led you to Memory Lane TV, and then Angie, I'll ask you the same question.
Well, thank you. I think I don't want to give anything away, but yes, my name is Alban. I am the CEO and founder of Memory Lane TV, and I'm really happy to join this conversation. I don't know how many people are here, but hello, everybody. We're calling you, and we're both in sunny Portland, Maine. I mean, it's sunny today. And I'm a film producer. I'm an entrepreneur and specializing specifically in integrative and digital health ecosystem. And I don't want to give it away too much because this is part of the surprise, but in a nutshell, this is who I am.
Okay, great. And then Alban, when we were chatting, I was like, when we spotlight new technology on these discussions, inevitably somebody is going to ask, well, who's using this? Can we talk to somebody who's used it? And that's where Angie comes into play. Correct, Angie?
Yes, of course. So my name is Angie Hunt, and I want to thank you, Steve, and the pro-aging community for having us today. So thank you very much. I am actually, have been the Chief Operating Officer at a senior living community in Portland, Maine called the Cedars, where we've done a lot of work with Memory Lane TV and have used it for multiple different ways. So hopefully we'll have a nice, robust conversation surrounding that. So thank you.
Oh, I love it. All right. Well, we got those intros out of the way, so let's dive in. I think, Alban, you've got some slides that you are going to share with us. And then I just want to remind our audience that if at any point in time you've got a question, you've got something that pops into your mind, throw it into chat or Q&A, and we'll make sure that we address it on here. But I'm gonna dive behind the curtain here and let you share your screen.
Oh, yes, I should share the screen. That's right.
Yep.
There we go. And then start the slide. I did this reverse. So here we go. Can everybody see my screen now?
Yep, that's great.
Fantastic. So some of you may have already detected a slight accent, and that's right. I'm French. Actually, I'm Franco-American. I'm also a citizen, and but I grew up in Europe and Africa, and for some times my father was an expatriate. I spent a lot of time with my grandmother, and her name was Rosette. You see her at the bottom of the screen here. She was the kindest, most generous, funny, vivacious woman I've ever encountered. She's always happy and singing and dancing and loving unconditionally, helping the world to be a better place. And she was my mentor. So I want to introduce her to you. I always think it's nice for 15 seconds, but you'll get a sense of that. I'll stop it here. I'll send you the link if you want to see her dancing some more and getting dressed. But that gives you a good idea of, my motivation behind Memory Lane, because when she was diagnosed with dementia and Alzheimer's disease, I decided to do something about it. And since my early 20s, I developed a passion for integrative health and palliative care in general, for helping people through different modalities that traditional Eastern medicine does not cure, because we don't have yet a pill to solve this. So in the case of Alzheimer's, I knew that there was no medical solution. Lots of us are aware of the condition, no pill for the disease, but there was something that was just birthing called digital therapeutics. So I started to investigate, and I discovered a body of published research available to manage the symptoms of dementia, PTSD, and other brain degenerative disease, around multisensory stimulation. So not only about Alzheimer's, but specifically around dementia could help a lot. I dove into the literature and because I'm a film producer, and I know the impact of an image and soundscape and music when you are immersed in a cinematographic environment. And I'm sure all of you knows that, because most of you, almost all of you, I bet, have been to see movies in a theater, so you know what we feel when we get there. I created Memory Lane TV, and I started to assemble plot-free content that she and her friends in the facility that she was staying could easily relate to. And that was entertaining content, meditative content, reminiscing content. I mean, reminiscence is a science that has demonstrated its impact clinically in many research. And in a nutshell, this was the beginning of Memory Lane TV. And that journey started 8 years ago. And I surrounded myself with geriatric physicians, occupational therapists, nurses, physicians, that would care for Alzheimer's residents, psychologists, and all sorts of specialists, and Angie being one of them, world-renowned, some of them, that's basically what Memory Lane TV has become, because we all shared one vision, which was essentially to disrupt dementia care and its traditional approach through a multi-sensory and human-centered approach that A, improved the quality of life, B, moderated the symptoms of dementia, and C, most importantly, offers respite to the care partners themselves, who, as you all know, have a huge toll on through the course of the pathology. So for almost 8 years, and after some implementation, testing, and research with over 1,000 people, we've launched last February Memory Lane TV, and it's now, I'm happy to say that it's now live on all streaming platforms, Apple TV, Roku, Amazon Fire Sticks, in any living room, anywhere in the world, as a 24/7 live stream or a la carte content to personalize your experience. We're going to get into this. But let's start with just a few images so you can get an idea of what the intervention is all about.
Memory Lane TV is a multimedia and multisensory intervention designed to improve the quality of life of people living with memory loss. It is a non-pharmacological digital tool that uses the power of cinematography to positively impact mood, communication, and a sense of well-being for users. Leveraging over 50 years of scientific studies on multisensory stimulation and mind-body medicine, our films were developed and tested in clinical settings. Memory Lane is a simple, cost-effective tool that offers care partners a bit of respite from the daily stress of supporting those with memory loss. Our program allows the viewers and their care partners to engage positively throughout the day, reducing anxiety, depression, agitation, and disorientation. The magic of Memory Lane is the combination of multisensory stimuli intended to evoke positive feelings and new memories in the viewer. When people are engaged with Memory Lane, they feel immersed, focused, and happier. Enroll with a free trial now. Press play, pause the day, and start experiencing the moment.
And here we go. Some of you might have recognized Bob Ross. Believe it or not, I mean, this is not my generation, but I had no idea who Bob was. And I'm so glad to have him because he's very soothing, especially at the end of the day. Anyway, we're going to start by talking about, the knee. Why did we do that? Very quickly go through some of those slides. Some of you may know that, most of you probably know that this is probably one of the greatest challenges of all time. I think I'm going to let Angie, because she's better expert than me, to just go over really quickly about, why this is an important tool.
Thanks, Alban. So I just wanted to set the stage for just a few minutes, but as many of you know, one of the greatest challenges our society is going to have is the growing crisis of dementia, in which Alzheimer's disease obviously is the most common. I think I heard a statistic that every minute, every 60 seconds for the next decade, somebody is diagnosed with Alzheimer's disease. That's pretty powerful. And today, more than 6 million people in the United States are impacted from this disease. And 130 million are going to be projected globally by 2050. And the disease burden is significant. And according to the Alzheimer's Association, in the United States alone, $355 million in 2021 was spent for Alzheimer's disease. So as Alban pointed out, although there's been much learned about Alzheimer's disease and other dementias, breakthrough medications are quite some distance away and are not right. We don't have those right now. So really of paramount importance is the need for non-pharmacological interventions to assist in the management of Alzheimer's disease and other dementias. And we want to support people's quality of life and well-being. Next. So caregivers are really seeking better solutions today. So we talked about, the importance of having integrated health approaches that are effective. And those are those non-pharmacological interventions that can help improve quality of life and well-being, like memory lane TV. The other thing too is, dementia causes unique challenges, not for those just living with it, but also for the people that support them and love them. There are physical, emotional, and psychosocial burdens on caregivers today, and there needs to be solutions to help them through this. Also too, I work in a long-term care facility, and COVID-19 has taken a big toll, an unimaginable toll on the elderly population in these settings and the staff that supports them. And especially in communities that service people that are living with dementia, they need solutions to help them with integrating and engaging people that are living with dementia. So the bottom line really is that caregivers in long-term care communities need better solutions to help them. They need the solutions to help with staff efficiencies and productivity and provide high quality of care. And people at home need solutions to have tools to engage with their loved ones, or to have time to have a little moment of time to make dinner. So we're all seeking these better solutions.
And I want to add to that, just to give perspective, 80% of the people living with dementia are staying at home, like Angie was saying, and they don't have access to professional tools like you do when you, in the later stage of the disease, you get to a facility and you've got professionals and occupational therapists and activity directors and nurses and CNAs, and a whole infrastructure. But for the first years of the disease, it's, as most of you know or can imagine, very challenging. So there's a lot of education, training, and tools that we can bring, thanks to technology, right in the house of everybody now, and we're going to work into that. Angie, I'm going to let you also talk a little bit about some of the research and jump in if we need, that we've developed, because memory lane, we didn't invent anything. That's why I'm always want to introduce this like this. There's a 50 years of research in those non-pharmacological approaches. Go ahead, Angie, if you want to do that.
So 50 years of research, and that was the basis for the foundation of Memory Lane TV. And the sensory stimulation research shows that it improves physical, psychosocial, and cognitive conditions in people living with dementia. It also could be an effective method or intervention to improve individuals' overall condition and help improve their quality of life and well-being. Interventions that Alban talked about, like, music. Music is just an incredible, powerful tool that can help reminiscing with somebody living with dementia. And even just learning reminiscing techniques when you're looking at something to help people recall visuals and that. So there's been a lot of research on all these interventions. And the great thing is, Alban has packaged it all up together. So it's this body of foundational research in which the different sensory channels may provide different and potentially complementary effects for people living with dementia. And this is the research that went in the foundation at Memory Lane TV. So the other thing too is there's pretty much building on that clinical research. There's 7 overarching design components of Memory Lane TV. And I'm going to start with the circadian rhythm disorder that people sometimes experience with dementia. So in Memory Lane TV, there is a component with circadian rhythm. So there's sessions there for the morning, for the afternoon, for the evening, and even at the night. Sensory activation. As we told you, we took all those 50 years of research. With sensory activation, there's guided imagery techniques, there's music, there's reminiscing, there's even an olfactory, a smell component, movement and touch, all combined so to make it multisensory. In engagement, the great thing about Memory Lane TV, it is for people living with dementia, but it also has, as Alban alluded, this caregiver channel. So it has caregiver education, it has tools, it has a user's manual in it, and also it has all types of tidbit information on how to use Memory Lane TV. And the technology is really great about it, and it is an immersive, when you sit somebody in front of a big television, the cinematography experience is just amazing. So our findings, so we also did some work clinically to look at Memory Lane TV. And I think the first work was done in France. It was done with Dr. Raffin and also with Dr. Winfield. And they're both geriatricians. One was a physician, one was a psychologist. And this was done in Tours General Hospital in France. Also, there was research done at the Mass General Hospital, at the Benson Henry Mind and Body Institute. And lastly, there was some studies done in Maine with the Southern Maine Area Agency on Aging, their adult daycare program, and also where I work at the Cedars. And the thing about that, we all found similar results with the Memory Lane TV. First of all, 95% of the users had a positive experience. Overall, they loved it. They had a great positive experience. 74% of them reported improvement in the resident or the staff's mood, the mood. And then 67 reported improvement in engagement. People were socializing more, talking more after they saw it, or talking to caregivers or other people. 70% exhibited improved interactions, and 70% noted a reduction in stress level. So the Cedars and the University of Southern Maine worked on the data together to look at this. And we are also in the future having IRB studies conducted with Memory Lane TV.
Yes, this is important to know. I mean, it's, from the ground up, this was built from the field as an entrepreneur and a filmmaker. I'm a problem solver, but I also know that there's nothing I can do without the help of a big team and without identifying a problem and trying to solve it with everybody involved. And this is really what we did. Because when I entered into it, I was just like, oh, music and memory. Oliver Sacks has described this in the 70s. We know how we feel, right? With our own favorite music. You play it in the radio and you start, reminiscing, dancing. There's a great movie, by the way, called Alive Inside by Michael Rosanna Bennett that tells the story of music and memory, specifically specialized playlists that are also used in many places to help do a lot of reminiscence. That is really what they call music illumination. And I like to talk now about what we've done, because Angie just pointed it at that. We've created what I call a media illumination. We took all of those elements and we put it into one, and we're using the power of digital therapeutics, the power of music, images, olfactory stimulation, engagement, person-centered care, the research behind it. And we took it to those places in clinical settings, and we said, okay, how do we solve the problem in the morning? appetite incentivization, engagement, communication. How do we find the people that we love? And heralding at night. We're going to get into a little bit of that in more detail so that you can actually see how it works, but it's very straightforward and simple. I think I'm going to play another small video just from testimonials, because Steve said, hey, you have other people that can talk about memory lane a little bit. And let's see if I can start.
The nice things about it is we can individualize it for just one patient. If they're having a particularly bad time, to calm them down, and it gets used every single day for at least 2 to 3 hours.
It's been a very great tool for the staff. As an administrator, you always have a lot of people during the day in your facility. And the beauty that I like about Memory Lane TV, it gives the nurses a tool, especially on evenings and night shifts. So it's been a really good tool to use, especially on off shifts when there's not as much people in the nursing facility as the days, though we use it all the time throughout all our 3 shifts.
We try to give the staff tools that they need to be able to handle situations that come up with residents. And this is one more tool to help them to be able to engage a resident where they might be, they've used everything they can use and they're not sure where to go next. So this programming is a good addition to their toolbox.
She said that it makes it so that I can get my job done. And I thought that was a really interesting perspective, because it doesn't change the intensity of everything that she has to do, but she was freed up. Like you said, she's not trying to answer call outs. And somebody said that there had to be less call outs and calling out during that time period.
I was looking outside of the room and I noticed that it was much quieter and that the nurses and CNAs seemed like they had a lot more space to get their work done.
If we have one staff person who can run Memory Lane TV and offload the rest of the staff from actually having patients at their heels or assigned to have in that physical space too.
My experience with Memory Lane TV has been unbelievable, and I definitely plan to use it as I grow my career. Seeing the residents' faces light up as they use Memory Lane TV and really relax has just been a great experience.
I think Memory Lane.
I'm going to stop here because I want to emphasize also something very important before I actually show you how it works, and we can go to Q&A. The foundation of the research and what we wanted to do, I wanted to address specifically what I was personally confronted to and what I know a lot of people were confronted to at home. So I started by saying, this is a tool that everybody can use at home as well. And we've seen that in the clinical settings, generally, it addresses people at the end stage of dementia, but this is a tool that you can start using at early onset. And I'm sure all of you can relate, especially after the period we've all gone through with COVID, right? Television is anxiety producing. The programs are not catered for guided imagery, relaxation, and they provide anxiety to us. And when we're in a state of anxiety because we watch the news, the war, the COVID, whatever, imagine what that means for someone who has memory loss, who thinks everything is true, and which happens every day, all day long. So yes, it works really well in clinical settings. This is where we've developed it, but we've also, of course, tested it into homes. And any one of you, I mean, Memory Lane runs in our office 24/7. I don't think I have early onset dementia. I don't know, but we all enjoy it so much all day long. And we talk about it. We're anchored in the present moment, thanks to the programming. So let me just to show you how it works. And actually, I'm going to take you on the platform as well. So you see some of the content that we've developed. Before I entered, I just want to say, those are some of the symptoms that we manage and deal. And Angie talked about, the care partners and the individual with the diagnosis. So, we know memory loss is a problem as we are all aging. I suffer from memory loss. I'm not ashamed to, admit. Depression, sometimes, especially in those days. Aggressivity and anger is a manifestation of some of that stress and nervousness activity. Confusion, circadian rhythm disruption. So that means that you lose the time of the day, and sometimes you errand at night and you don't know what's going on. Appetite loss, So those are the symptoms that people that start to have dementia experience. And I was trying with the team to really address those. So with some of the films, we are able to incentivize appetites. We're regrounding with human-centered activities, what we're doing. Guided imagery is also a science that has been evolved, and so forth. You can see those elements on your slide, but the care partner is also experiencing different types of symptoms, but also lacking tools. Yes, there's no cure. It's really hard to find the person that you love. You feel that you've lost them. So how do we reconnect? How do we learn how to communicate? How do we not get frustrated when we have to repeat the thing several times? Well, there are tools, there are ways we can do that to redirect attention. Angie talked about the caregiver channel. It's a very big part of Memory Lane. You'll see that in the, education and training. We've got the best trainers in the world, UCLA, Teepa Snow, the Down methods with Judy Cornish. I mean, we've gathered people so that they learn how to do and what's happening and how to manage it. I always start by saying, of course, we always try to look at the best things of life that happens to us, but there's a good side to aging as well, and memory loss and dementia and Alzheimer's. And one of them is like when you find the good trigger, the right joke, right? You can say it several times, or you can use the same tool several times, and you will feel better every time. Let me move on to the actual platform. So it's very simple to access. You just need a broadband internet, a streaming device, and a television. I'll talk maybe a little later, if we have time, to the aroma diffuser and how we've used olfactory stimulation through our olfactory toolbox. And that's the only part that uses a physical device. The rest is all digital. And so you don't need much, whether you're at home or in a facility. Once you're connected, you all have a TV. Maybe you don't all have a streaming devices. And by streaming device, I mean Roku, Apple TV, or an Amazon Fire Stick, an iOS, or a tablet. We're available on all tablet. And then you can register on Memory Lane through, just like you would create an email or create a Netflix account. Basically, it's very straightforward and simple. So you sign up, you enter your credentials, and one of the specificity, I mentioned the term human-centered, person-centered. One of the specificity of Memory Lane is also the fact that in order to work, it has to resonate with our own story, right? So, your favorite song, or the person's favorite song. So the first stage is that people will enter their life story. It's a very simple background check with the sensory elements that constitute your life, your favorite music, where you grew up. We're in Maine here, and I grew up most of my life for the past 30 years in Maine. So I love the ocean. It resonates with me. And I can't take a walk to the ocean every day. And surely when I visit those nursing homes in Maine, and I'm happy to say that most of the nursing homes in Maine will use in the next 6 months Memory Lane, all of them, thanks to the Maine Dementia Coalition. The reality is we can't wheel everybody to the beach, but we can bring the exterior inside. We can show them those images through a cinematic experience. It's not the same. We don't want to put people in front of television, but we do want them to experience some of that 2-3 times a day so that they feel better and they're anchored in the moment. So let's dive to the service demonstration, because we talked a little bit about some of those elements. I'm going to talk to you about the restoring a daily rhythm, show you some elements of that, how it's plot free. I know that what does that mean, plot free? There's no plot, there's no story. Well, yes and no. It's frustration free. There's no character driven, so you don't have to follow a story. We've measured that for 20 to 26 minutes, we can have the attention of pretty much everybody in the room. I guess I'm over 26 minutes, but I still hope that I have your attention. But you can drift in and out of those stories, and you don't have to necessarily follow a plot, that can be complicated. So that's what we mean by plot free. Of course, when you lower stress and anxiety, or when you have a panic attack, for example, someone has a panic attack and you need to manage, we are all trying to find solutions. What can we do? What can we do? My mother thought I was a magician when I used those techniques that I had learned, because I was able to calm my grandmother's panic attack instantly by touching her, by redirecting her attention. Instead of saying, what do we do? Do we call 911? Give her a pill, give her something. And you use less medication, and you're through education and using those tools, we can do that. And memory lane can help with that for resolving conflict, for example. That redirection attention can help that. And you don't need to be a professional nurse. Of course it helps, but we can train people at home to do the very same thing. So I'm going to take you through some of those videos, and because we don't have time today, I will, of course, put in the chat, and Steve will share with you all the links. We have a lot of really simple videos that help you to understand how we do all this, how we use the power of music, mindfulness and yoga, how we restore that daily rhythm, or how we use positive interaction to resolve conflict or to lower anxiety, and how we use those sensory plans. You might say, multisensory, I talked about olfactory, visual, auditory, obviously, cinematic experience. It's not just about turning the television, but how do we use touch? How do we use taste? Well, you can investigate some of that and educate yourself with our caregiver channel. Let me see if I can switch. Does everybody see that new screen now? Angie, do you see it? You do? Okay, so here is first of all, this is where you're going to be able to see everything. It's on memory-lane.tv. This is our informative website. You can navigate through it and see the sample of the collection, how we personalize it, how to watch it. We have some really great videos on how you use the technology, how you sign up on Roku and all those. So this is the website. But once you've registered and you understand what we do, and there's also a great blog, by the way, lots of resources about how it works and how to communicate, and things like that. But once you've registered and you're at home or in a facility, this is the infrastructure. This is what you will see. Basically, you'll enter directly in that infrastructure. This is my memory lane TV. It's personalized for me. You see my little logo on top right. And I was telling you there are two ways to use it. You can either use it a la carte, and I'm going to take you through those libraries, or you can use the live stream. When you're in a facility, you don't necessarily have time to just mess up with lots of things and program it. So sometimes it's just as easy to just put it on and replace television. And we've pre-programmed 24/7, 7 days a week, the content that we use to address various different needs at different times of the day. So, and it's as simple as pressing a button. It's really that easy. See, I click on Watch Now, and here I am this is live, by the way, on Memory Lane TV. So this could be forest bathing. So this, for example, is not very engaging, right? So we don't need to engage people all the time. There's no story, right? But there is a story, and I've cut the sound off. Normally there's soothing music that goes with it. It's like forest bathing without being in the forest. We don't need to engage people. From a level from 0 to 5, this would be probably 1 to 5. This would probably 1 on the level of engaging. In the afternoon, we have much more engaging sessions that are level 5, where you have quizzes where you can stop the music, stop the film, and interact with people and you can download PDFs and just use that. This is more guided imagery through visuals and nature-oriented things. So it's like I was saying, I wanted to show you this because this is live right now. And if we were to let it run all night and all day, it would follow the circadian rhythm. What time is it right now in the Eastern? It's 12:30. So probably an hour ago, we would have programs about food and appetite incentivization, really great food. Every time I watch it, I'm just like, let's go out for lunch. It's time. So let me stop that and run you through the catalog, what we call a la carte. This is how you navigate through it. So this, because I've already logged in, I can continue to watch the films just like Netflix, essentially, very simple. The watch list category that I created specifically, I mean, we're in Maine here, right? So those are the films, some of the films that I've created and added to my own list, or that was generated by the watch list I was telling you. A very popular film that we use here in Maine. It's called the Freiburg Fair. So again, no storytelling, no voiceover. It's like being at the fair. I wish we could bring everybody to the fair. We can't. But people who have grown up in this area are very familiar. The Common Ground Fair is actually happening next week. I can say with almost certainty that out of the Cedars, where Angie is right now, none of them will go to the Common Ground Fair. Maybe one or two. First of all, it's in Liberty, Maine. It's far north. Secondly, we cannot bring those people over there, but we can bring them there, through those stories, and they can interact and feel good for an hour and a half with it. So this is just an example of it's out of one of our collection, and it happens to be in my list. So the way we, of course, lots of informative, really short film on how to optimize your use, and the sense of cinematic perception. Godard, our French, very famous film director who passed away a couple of days ago, was an expert in creating stories that would bring people in. And I grew up as a filmmaker, as a photographer, as a visual storyteller, knowing the importance of taking people into this world. And this is what we've reproduced here, because some of the best film makers of my network have come to help me to bring those. I didn't film all that. There's over 500 hours and growing every week. We drip content. We have new content every week of content that was produced and documented by some really incredible people. So we create those stories, those narration, and it needs to be in sort of a cinematic environment. When you start using memory lane, you need, and especially for people who have visual and auditory impairment, a big TV if possible, lower the light, just to get immersed into it. That's an important element to understand. So circadian rhythm, the time of the day, this is one of the ways you can navigate, from when every season has different types of videos for morning, afternoon, and evening. And if you go into any of those, you will see that they're all organized, so you don't even have to think much, and you have 26 films, 26-minute films that take people through that daily use. So this is one way you can access to it. Sundowning, and maybe Angie can talk about that a little bit, but some of you who are not familiar with the term, is the anxiety and stress that comes towards the end of the day. Is a big problem, in not only in facilities, but for people living with dementia. We don't know exactly where it comes from. Tiredness, end of the day, change of shifts in facilities, but it's a really major problem to address. So we've created a very specific series of films. We call them medleys that last 26 minutes that can be personalized to the person and that take people into that reminiscence. No storytelling again, and I'm not going to show you, all the films that we have. We have over 350 films in there, but we're able to redirect the attention and manage some of the symptoms related to Sundowning syndrome, for example, through those medleys. And those are very engaging, a lot more engaging than the one I've shown before. And they range from 13 minutes to 40 minutes sometimes. You can see little kids opening presents, and we have films at Christmas that are different, that from Thanksgiving and all that. They're adapted to the time of the day, the season, and the place, and the person itself. It's very much person-centered. So I'm talking a mile a minute trying to get
Alban, can I put a couple stories in there for you?
Please do.
Yes, so I have a couple things. First of all, my mother personally she recently passed away, but had advanced dementia. And we did a kind of a customized memory lane TV for her. And every time I put it on and sat with her to interact with her while she was watching it, she was like so happy that she got to see some of these images and places that she had visited that we talked about. And even the music, some of the music in it, she had, I think we had a big band song in there. And the minute she heard that big band, I happened to buy her some Congo drums because she was very into music and she really could get the beat really, really good. And she would just jump up and just go to those Congo drums and start playing them, which was really remarkable with no prompting from me, whatever. In the Cedars, in the facility I work at, which is a 102-bed skilled facility, I actually did, as an administrator, I did an activity with the residents myself. And I decided to look at the apple baking. He has an apple baking, somebody making an apple pie from scratch. So what I did is I got residents that, liked baking and, cooking when they were younger, got them together in a room, and we put the apple pie on. And then I had the scent of the apple pie. I had real apples. And then I got all the appliances that you would use to make an apple pie, the whipper, the spoons and that. And I passed them around so people could feel them and talk about. And during the movie, the session, I would talk to them and say, well, who has a recipe? When did you bake your apple pies? Were they mostly holidays and then we talked about, picking apples in orchards, our big thing in Maine. We talked about that. So we really integrated the group together, and they talked and told their stories about it, and did a little reminiscing. The other thing too is mood. There is a great medley in here with just children's faces. And when you see, if you have somebody that's not in quite a good mood, and you put that on and they look at it, those children, their smiles and their faces, you can't help but laugh or, go, oh my God, this is so cute, So it helps change in that second, So it's those are a few stories.
This is great. Alban, you gave me a brief demo when we first met, but this more extensive demo really helps me understand the platform and the value of it. I know you said something, but I love the caregiver training aspect to it, that it's all here in one place. And this is, as you said, the research is out there, this content is out there, but for somebody to sort of piece this together, it would never be as complete or as easy to use, and that's what a lot of families are doing is they're bringing in a boombox, they're playing music for mom and dad, they're, doing a search on Netflix to find something, but some of this content is just so well thought out. I wanted to jump in here because I want to make sure, a lot of times folks need to jump off at an hour, and I wanted to make sure that we address some of the questions that have come in. And let's see, Valerie was wondering, are there plans for individuals in their apartments in like a life plan community to have access to this in their rooms? And yeah, I guess like in a community setting, a lot of the images that we saw was in the activity room, but is there a lot of utilizing this individually in one's room or apartment?
Well, that's a very good question. Because of the implementation of memory lane through any streaming device, yes, you can do that anywhere. It depends on the facility. Some facilities have systems that allows to diffuse the content in every single individual room. Some don't. So it really, I encourage you to go and talk to your facilities. And if they don't use or know about, and most of the time they don't know about memory lane TV, we don't have the means. And that's why I'm so thankful to you, Steve, to allow us to get people to get the word out. We can't afford big marketing campaigns. But essentially, anyone who would want to use it in a facility would need to have, internet access and that $20 Roku system. So you could do that, yes.
And then I know his real name, but it's I'm chuckling. I'm not even going to say anything. But one of our users says, "How do you access this with Roku and the other streaming devices?" So yeah, maybe I was wondering that as well. I know I've got like Fire TV, and you go through and there's a menu where you can upload apps. Is that how this is done as well?
Yes, and I think you're still seeing my screen, correct?
Yes.
So this is the memory-lane.tv, the informative website. If you go to programs and how to watch, you'll see we've created like, here's your answer, installation and Roku.
Ah, okay,
and
great.
2-minute, and it will tell you exactly, first you have to sign in, create your account. And then on any app, it's the same thing for Apple, Roku, or Amazon Fire Stick. You go to the store, you look for Memory Lane TV, you see, hey, here's the app, you download it, and then you enter your credential, and boom, you're good to go.
And so you've got this on all those platforms, which was probably, I can imagine, was not a easy task to get integrated in all those different platforms.
Not easy, and very expensive, and very long. It takes about, what you were just saying is so true. We can do a lot of that. We can create memory and sonic journeys or experiences for our loved ones because we know them so well. You can also design your own kitchen, by the way, and change your plumbing.
Yeah.
Or you can call a plumber and you can try to solve your own medical problems, or you go and see your doctor. What I wanted to do, and by the way, this is $8 a month. So
oh, yeah, that was my next question. Somebody was wondering, how much does this cost? Yep.
Well, for a facility, which is public use, it's $90 a month. For anybody at home, it's $8 a month. I'm trying to find, hey, Warren Buffett, Jeff Bezos, and all people out there, let's make this free for everybody. I'm trying to find people to help us to really provide it, because there is an emotional and logistic toll to dementia. There's a financial toll. We all know about it. Even $8 is a lot of money sometimes. It's $80 a year. We have to have minimum funding and to be able to run this. But I tried to make it really as low as we can. There might be a way, again, talk to anybody who has a lot of money so we can put this in a fund and give it away. But it's very affordable.
Yeah, and out of curiosity, I mean, $8 is not, again, everybody's on a different budget, but to try this out, that's a very affordable way to give it a shot for a month. But with some of these apps, they have sort of a free, try the first month for free. Do you all have anything like that, or?
Well, we absolutely do. We stand behind everything that we do. We have a 30-day money back guarantee.
Oh, okay. Yeah.
Try it for 30 days. If you don't like it, 100% is refunded. That's more than enough time for you to try it, Absolutely.
Let's see. This is a question based on something that you said early on in the discussion. It says, Alban, thank you for your innovation. Great event today. Thank you. What was your own aha about the pandemic experience, isolation, loneliness, etc.? I forgot what you said back then, but I think you were talking about an aha moment, and they just wanted to know what your pandemic aha moment was.
Oh, that's sweet. Well, my aha moment was, we all experienced really deep isolation, right, during the pandemic. Well, let's think about that for a second. When you are living with dementia or Alzheimer's, this is the type of isolation you feel every day, all the time. So to me, it was really good that the whole world now I can tell you that, and you said, oh, wow, is this really how you feel? There's no better advocate than, and I have a few, of course, in our realm, people that can really talk to you about why it's so important. When you're cold and when you have Alzheimer's in the middle of the night, you don't know why you're cold. You don't know that you have to take the cover at the bottom of the bed to put it on to get warm. And so unless I'm telling you this, unless you experience that, unless you've seen it, you do not know what it's like. Well, you do know what it's like to be isolated during COVID, right? And you know that music was important. You know that Netflix was important. You know that talking with your friends, with your family on your devices was important to get out, to breathe. Well, this is what we're doing. And this was my aha moment, like, oh, yeah, my work can be really implemented everywhere around the world in an easy way.
Another good question here. Oh, they said great answer. Thank you. Another is speaking of helping out as the U.S. grows more diverse, how can others with ethnic backgrounds help you add more diverse content?
Well, that's a very, I don't know if people saw it when I went online, but and I'll show it very quickly. We have thought about that, of course, LGBT community, Afro-American community. We have a specific collection, veterans, people. We have very specific collection. I'm just going to scroll through it so you see some of those that we've developed for those special communities and people that would relate to, here we are, for our special community, for people in different areas of different cultures, speaking different languages.
And in knowing you, I'm assuming that, like, if let's say that somebody reached out and, you know, they subscribed and then said, hey, look, you know, my grandmother is German. Is it possible to find some German content? That's how this platform can grow organically, is that if your customers are making requests and then there's, are you able to accommodate those types of brainstorming sessions?
Yes, we do everything that we can to do exactly that. We drip content almost every day. Every day there's a new film that comes in, and we can go to Italy right now, Ohio or Holland, and if you type German or French or Ohio, you might be able to find something that relates to every one of us. Absolutely, very important. The person-centered approach is essential.
That's great. That's fantastic. Well, I see we're almost to the top of the hour here. I got through all of our questions in the queue. They were great. And then are there any sort of closing thoughts that you and Angie, I keep on wanting to call you Debbie,
that's okay.
Angie would like to share with our audience? And again, just to remind everybody, I'll make sure that we have this recording. Contact information for Alban. I hope that you check this out. And I really see, while I see the value of this in community settings, as we saw and as Angie had shared, man, with some of the conversations I'd had recently with people that are caring for their loved one at home with early stage or late stage Alzheimer's, I could see where this could be a godsend, and it sort of gets you from turning off the commercial TV to something that is much more engaging, that can create conversation and be more stimulating to somebody with memory impairment.
Thank you, Steve. Yeah, thank you for the opportunity. My last comment would be, you know, it's World Alzheimer's Month, and on the 21st, it's going to be the World Alzheimer's Day. You know, I invested every single dime I have, you know, in this project, 10 years of my life, and it's a priesthood, and we don't have enough funds to fund the marketing. So if everybody here today were to publish on their social media, hey, we've discovered something, put it on your Facebook, Instagram, whatever, you know, we need to have shouts out there. And if you know any of those big players who have been personally affected and could see the value in that and would like to help our community, bring them over. That's my final message. Shout out. Thank you so much, Steve, for the opportunity.
I love spotlighting pioneers and innovators and entrepreneurs, and I'll make sure to share this with folks so that they can share it. And let's hope that this is a platform that expands and touches many more lives in the future. And Debbie, Angie,
Yeah.
I know that I really appreciate you sharing your insights as an operator who's used this. And
I just wanted to leave and say one thing too. Everybody should have this. It's affordable, you know, it's fairly affordable, you know, and it is a remarkable thing to have to help you at home, not only in a community, especially, you know, for people that are caregivers at home that really need some type of support.
Great. All right. Well, thank you so much. And we will thank you for your time, and we will see you all later.
Thank
Goodbye.
you.
Au revoir, everybody. Thank you very much for coming today.
Yeah, thank you.